In this video, we demonstrate how to collect data from a patient and do a clinical exam. For this demonstration, we will be using the Pulmonary Screener mobile app, and in a previous video, we have already shown how to create an account for the doctor and how to log into the phone, and we have also demonstrated how to create a new account for a patient, so how to register a new patient. So once you have that, you would be ready to do an exam. So to start, I am already logged into the phone. I am Dr. Tom Smith for this demonstration, and the name of my study is Test Group 3. As we have mentioned in a previous video, if you want to collect data for a different study, you can go to the settings and go to My Groups, and here you can change the study to a different one if you belong to multiple studies. But in this case, I'm going to stay with this study called Test Group 3, which we use for demonstration. So I'm going to do an exam on a patient that is already registered, so I don't need to do new patient. So I'm just going to click on existing patient. And here's a list of all my existing patients, and I'm going to do this last patient. And the patient's ID code is P4567. So I click this one, and that brings me to the patient screen. I can then look at the patient's profile. I can edit that profile if necessary. I can also see what groups, what studies the patient belongs to. So this happens to be a patient that belongs to the study named Test Group 3. These are the different functions that I can do using this patient data. So in this video, we're going to demonstrate the exam. So I just click Begin Exam, and I am ready to do an examination and collect data on this patient. Hi, I'm your doctor today. How are you feeling?
My chest hurts and I have some trouble breathing.
Oh, okay. Well, we're going to talk for a little bit. I'm going to ask you some questions and then do some tests. So we'll start with a questionnaire. So you were just weighed. So I think your weight was 24 kilos. Your height's approximately 144 centimeters. The nurse just did your oxygen and that was fine. It was nearly 100. So you say you do have a cough. Is that correct?
Yeah.
Okay. How long have you had this cough for?
Um, a few months now.
Okay. All right. I'm gonna put 1 to 5 months. When you cough, does it produce any phlegm, or is it just a dry cough?
It's a little bit of both.
Okay. I'll put yes. How about your nose? Has your nose been stuffed?
Yeah.
Okay. How long have you had a stuffy nose? Like less than a week, or a lot of weeks, or a few months?
Well, a few weeks.
Okay. Do you have a fever? Okay, so we established that you don't have a fever. That's good. What about symptoms? Do you have that?
Well, not a lot.
Okay, that's normal. I'm good. You're chesting and say that you have yes. And how long have you had chesting? How many days on weeks?
Well, a few weeks.
Okay. Do you have any allergies?
A few.
Okay, what do you allergies?
Bugs and super cold weather.
Okay. Does your family have a history of allergies?
No, I think they're past.
Okay, I'll put yes. And what about COPD? So COPD is a type of lung problem. Does your family have a history of COPD?
No.
Okay. All right. Are you currently a smoker?
No.
All right. Do you used to be a smoker?
No.
All right. Do you use tobacco?
No.
All right. Do you use tobacco?
No.
All right. Do you drink alcohol?
No.
Do you consider alcohol?
No.
All right. Do you put a wood fuel? Is it so?
No.
Okay. And do you use wood and fire?
No.
Okay, great. The questionnaire is done. Next, I'm going to listen to your lungs and see how that sounds, okay? So, okay, so first we're going to listen to your trachea. Okay. Now take 5 deep breaths. Breathe in, breathe out. Okay. Now I'm going to take a listen to your back, okay? I'm going to listen to your lower right and see how that sounds. Okay, take 5 deep breaths, please. In and out. In and out. In and out. In and out. Okay, good. And then the last thing I want to do is record some of your cough sounds, okay? Please take this and cover your mouth, and when I tell you, you please cough, okay? Okay. Okay. Okay, go ahead and cough, please. Very good. Thank you. So I am going to save the results of the lung exam. And now we've completed 2 of the 4 tests. So I'm going to unplug this and we'll move on to the peak flow meter. I think you may have used this before. This is a peak flow meter. So I want you to blow into this when I tell you, okay? And you don't have to breathe into it, you just blow. Blow as hard as you can, okay? So I'm going to give that to you. So we're going to start the peak flow meter test here. Click start. So go ahead and take a deep breath, sit up straight, and now blow into the meter. Okay, and please hand it to me. Okay. Now we're going to record the reading. Okay. And then we're going to do it again. Okay. Go ahead. Reset it. Take a deep breath and then blow. Okay, very good. Okay. Okay. And then do it one more time. Okay. Great. Okay, so we know your height is 144 centimeters, so I'm going to save that. I'm going to upload it to the cloud. And we're done with the peak flow meter. So now we've completed 3 of the 4 tests. Let me put this one away. And the last thing I'm going to do is basically, I'm going to just take a picture of your face, okay? So let me attach this little camera to the phone. So sit up straight, please. And when I tell you to, please take a deep breath and hold it, and then you can exhale when I tell you, okay? So give me a second here to start. Okay, so I'm now focusing on your face. That's pretty good. Okay, please take a deep breath in and hold it. Hold. Very good. Now exhale. Very good. Okay, great. So we are done with this part of the exam. And we have completed all 4 tests. So I'm going to click done. So thank you very much, and we're going to analyze the data, and then we will get back to you with some results, okay? I hope you feel better. Once we have finished collecting data, we could review the data that has already been collected And all of the different data types are indicated by an icon. So this is the peak flow meter, for example. These are the thermal images. The lung icon represents the lung sounds. So I measured lung sounds in 3 different locations. This is the questionnaire data, etc. So, and if I want to review any of this data, I can just click on it and then I can see the results from the clinical questionnaire, for example. All of the other measurements are similar. I can look at the images that I took, or I can look at the peak flow meter reading. Now, as you can see, next to each measurement, there is a cloud with a dotted line and a red X inside. What that means is that this measurement has not yet been uploaded to the cloud. So if we want to do that, for example, this is a lung sound. If I want to review this lung sound, I can hit play and it'll play back the sound for me, which is what it's doing right now. I'm going to stop that. What I could do is I can also label the lung sound, and that is used for telemedicine. If somebody who's an expert wants to listen to the sound and define the sound and label it as a wheeze or a crackle, for example, they can use the label button. But all I want to do here is I'm going to push this upload button, and what that does is it's uploading that data to the server. So this is a lung sound, so file is slightly bigger, but it just takes several seconds to upload. There. So it says measurement successfully uploaded. So that data, as you can see right here, this sound, this measurement, which I just uploaded to the server, now has a green cloud with a check mark. So that means that this measurement has been successfully uploaded to the cloud. If you want to upload all of the data, you can push this button here, which is called Upload All, and that will upload the entire data set to the cloud. But if you only want to upload certain ones, then you can do one at a time, as I just demonstrated. So after you are done, we can move on to the next patient, or we can do some other types of computer analysis on the data, and we can give an automated diagnosis using one of the algorithms that's on the phone or on the server. In a separate video, I will demonstrate how to do the machine learning analysis and the computer diagnosis using the server and these other buttons on this page. Thank you for watching.